Did you hear any talk about the transition to providers who are also payers within the nonprofit track? Are people expanding that
Yes,
aspect?
yes, definitely another theme, much more discussion this year on value-based care than I've ever seen in the past. And I'll talk about some of those. Again, UPMC has a significant, about 50% of their revenues come from the health plan side. And one of the charts that they highlighted was the significant profitability that's been driven this year in a very difficult year for the provider side. It really drove the profitability. I think the segmentation of the slide was about $600 million of profit on the health plan side and a loss of $400 million on the provider side. So like all the other large providers, loss-making year, but because of the value-based network at the health plan, an overall profitable year for UPMC. Baylor Scott and White, about 15% of their revenue is now value-based care, whether it's from their own health plan or through their ACO arrangements. They have around 1 million covered lives. Christiana Care was a new presenter this year. They did a really nice job, actually. They talked about their joint venture with Highmark, and they really spent a lot of time talking about value and reducing the cost of care and creating an ambulatory network. Sutter, again, in the growth market, talked about building an ambulatory and physician ecosystem, and they want to be a value-based leader, as they call it. Advent, again, in a growth environment, talked about creating risk-ready networks. And then Intermountain actually has a very successful health plan, but also announced at the conference a joint venture with University of Colorado, UC Health.